Have you ever found yourself in the middle of a task or a conversation and suddenly felt like your brain was wrapped in a thick, fuzzy blanket? Like your thoughts were wading through treacle, words just out of reach, and concentration a distant dream? If you have, you're certainly not alone. This feeling, often described as brain fog, is a widespread and deeply frustrating experience, particularly for those of us navigating anxiety. It's a phenomenon that leaves many asking, why does this happen? And more importantly, what can we do about it? Today, we're going to demystify anxiety brain fog. We'll explore what it truly is, why our anxious brains sometimes feel so cloudy, and most importantly, equip you with practical, evidence-informed strategies to help clear the haze. This isn't just about understanding a symptom, it's about reclaiming clarity and regaining control. So let's start with a clear definition. Anxiety brain fog isn't a medical diagnosis in itself, but rather a collection of challenging symptoms. Think of it as a foggy haze that obscures your usual mental sharpness. When you're experiencing it, you might find yourself struggling to concentrate, experiencing frustrating short-term memory lapses, or feeling a persistent mental fatigue that no amount of rest seems to shift. You might notice your thought processes slow down, making it hard to articulate your words, or just feel a general sense of confusion or spaciness. It's a condition that profoundly impacts daily functioning and quality of life, making even simple tasks feel monumental. And it's a topic that's gaining significant attention, and for good reason. More and more people are recognizing these symptoms in themselves, and there's a growing public desire for real, actionable solutions. We're seeing it discussed in various contexts, from the general daily stresses of modern life to specific populations like women experiencing perimenopause, where it often co-occurs with other challenging symptoms. The search for understanding is crucial, because once we understand the why, the what helps becomes much clearer. Now, let's dive into the fascinating, albeit sometimes frustrating, science behind why anxiety can shroud our minds in fog. The link between anxiety and brain fog is deeply rooted in our body's ancient physiological and psychological processes. Imagine your brain as a supercomputer. When you're calm, all its processing power is available for tasks like logical thinking, memory recall, and creativity. But when anxiety strikes, a very different system takes over. This is our body's built-in stress response system, often called the fight-or-flight response, orchestrated primarily by a tiny almond-shaped area in your brain called the amygdala. When the amygdala detects a perceived threat, whether it's a physical danger or simply the overwhelming pressure of a deadline, it diverts cognitive resources away from the prefrontal cortex, which is the part of your brain responsible for executive functions like concentration and problem solving. Why? Because in a survival scenario, your brain prioritizes immediate action over deep thought. This diversion of resources is one of the primary reasons why clear thinking becomes so difficult. Anxiety itself consumes a tremendous amount of mental energy, leaving less bandwidth for anything else. Beyond this rerouting of resources, specific stress hormones play a significant role. When we're anxious, our bodies release elevated levels of cortisol. While cortisol is essential for managing stress, chronically high levels can actually impair the hippocampus, a brain region absolutely vital for memory and learning. This explains those frustrating moments when you just can't recall information, even if you know it's in there somewhere.
Shifting focus slightly, then there's hypervigilance. An anxious brain is often constantly scanning its environment for threats, both real and imagined. This relentless vigilance is incredibly draining and overwhelms your cognitive resources. It's like having a dozen apps running in the background of your computer all the time. It slows everything down. This constant scanning leads to significant mental fatigue, which in turn feeds the brain fog. Emphasizing a key cognitive function, anxiety also significantly diminishes what's called working memory, that mental notepad where we temporarily hold and manipulate information. If your working memory is compromised, it's much harder to follow a complex conversation, remember instructions, or complete multi-step tasks. Introducing a less obvious physiological factor, even our breathing patterns can contribute. When anxious, we often breathe more shallowly or rapidly, known as hyperventilation or tachypnea. These altered patterns can disrupt the delicate balance of carbon dioxide and oxygen levels in our blood, which directly impacts brain function and can lead to cognitive difficulties. With a comprehensive view, it's also crucial to understand that while anxiety is a primary driver, brain fog can be exacerbated by, or even co-occur with, various other factors. This isn't always just anxiety. Other mental health conditions like depression, generalized anxiety disorder, PTSD, or even ADHD can contribute. Physical illnesses such as long COVID-19, chronic fatigue syndrome, autoimmune conditions, diabetes, or even neurological conditions like a head injury can play a part. Hormonal changes, like those during pregnancy or menopause, are also significant contributors. And finally, lifestyle factors. Chronic lack of sleep, poor nutrition, especially deficiencies in B12, D, iron, or omega-3s, dehydration, and certain medications can all thicken that mental fog. It's a complex tapestry, which is why a holistic approach is so vital. Addressing common misconceptions with a reassuring tone. Now, a common concern many people have is whether brain fog signifies permanent cognitive impairment. Let me reassure you, for most people, anxiety-linked brain fog is a temporary and reversible response to stress, not a sign of lasting damage. Our brains are incredibly resilient. It's about recognizing the direct link between your anxiety and these cognitive symptoms, rather than viewing them as simply coexisting. Understanding this connection is the first step towards effective treatment. Guiding the listener on recognizing warning signs. However, it's also important to know when to consider if something more than just stress is at play. If your brain fog symptoms are sudden, progressively worsening, unexplained, persist despite getting good rest, or are accompanied by confusion, weakness, or changes in speech or vision, that's when experts suggest you should definitely consult a medical professional to rule out any underlying neurological condition. It's about being informed, not alarmed. Shifting to solutions with a hopeful and empowering tone. So, what helps? The good news is that because anxiety brain fog is so closely tied to our stress response, there are many effective strategies we can employ. A multifaceted approach is almost always necessary because we're addressing both the symptoms and the root cause. Starting with foundational self-care. The absolute cornerstone of managing anxiety brain fog is to address the underlying anxiety itself. This isn't a quick fix, but a journey of consistent self-care strategies. Simple yet powerful practices like deep breathing exercises, gentle yoga, meditation, and mindfulness can significantly reduce your body's stress response. Prioritizing consistent quality sleep is non-negotiable. Remember, lack of sleep is a huge contributor to fog. A healthy, balanced diet rich in essential nutrients and regular physical activity are also incredibly beneficial, supporting both your body and your brain. Taking regular breaks throughout your day, even short ones, can prevent cognitive overload. And for those moments when your memory feels particularly elusive, don't hesitate to give yourself cognitive support. Write things down. Keep a notepad handy, use digital reminders. These aren't signs of weakness, but smart strategies to work with your brain, not against it.
While self-care is powerful, sometimes we need professional guidance. Therapy, particularly cognitive behavioral therapy, or CBT, is highly effective for managing anxiety. A skilled therapist can help you identify triggers, challenge anxious thought patterns, and develop coping mechanisms that directly reduce your anxiety levels, thereby lessening brain fog. In some cases, medication might be an appropriate part of the treatment plan, especially for persistent or severe anxiety. Antidepressants or other medications targeting specific underlying conditions can be prescribed by a medical professional. This is always a discussion you should have with your doctor, exploring the best path for your individual needs. It's also vital to consider a medical evaluation to rule out other conditions that might be mimicking or exacerbating brain fog. Simple blood tests can check for things like thyroid issues, B12, or iron deficiencies, all of which can significantly impact cognitive function. Discussing your diet with a nutritionist can also be incredibly helpful, ensuring you're getting the right fuel for your brain. There's even emerging interest in certain supplements, like lion's mane mushroom, for cognitive support, but always discuss these with a healthcare professional before incorporating them. As we wrap up, I want to reiterate a few key takeaways. Anxiety brain fog is a real, understandable, and incredibly common experience. It's a symptom, not a personal failing, rooted in how our amazing bodies and brains respond to stress. But here's the empowering part. It is often temporary, reversible, and manageable. You are not alone in this, and there are concrete, practical steps you can take to clear the haze. By understanding the why, embracing self-care, and seeking professional support when needed, you can significantly reduce its impact. Our journey towards better well-being is often about making small, consistent changes and being patient with ourselves along the way. The future outlook for anxiety brain fog is one of continued progress. As we learn more about the intricate connections between our minds and bodies, we'll see increasingly personalized and holistic approaches. The emphasis will remain on integrated strategies that support both mental and physical health, helping more and more people achieve cognitive clarity and overall well-being. So be kind to yourself, keep learning, and remember that clarity is within your reach.